Well, we're just on the hour. Are you right to go, Petra?
Yeah, I think so.
Right, okay, good. I lost it. I had to reconnect. I'm not sure why. Okay. All right, good. Well, good afternoon, everybody. My name's Gemma Van Houdren. I'm the Director of the Statistics Division. It's lovely to see you all here today for our fifth cafe session this for Asia-Pacific Cafe session. My name's, as I said, Director of the Statistics Division, and the last few series we've been mainly focusing on the impact of COVID-19 on various aspects of our business. And a few months ago, when several of us were in New York at the 51st session of the UN Statistical Commission, which seems so long ago now, but our friends there in BPS Indonesia asked if we could organise a side event at our upcoming Committee on Statistics on population censuses. And we were very happy to be asked to put forward such a topic. And here we are 3 months later, and we're holding this side event, very early side event for our upcoming committee session, virtually, still on the topic of censuses, but this very unfortunately censuses during the time of COVID-19. So it's a slightly different take on population censuses that we're hearing today. We're very pleased to have with us 3 countries from our region, Indonesia, Singapore and the Philippines, talking to us about population censuses. And before we proceed with those, we are going to hear from UNFPA Asia Pacific, who provides such excellent support to our region on population censuses, and we'll hear first an overview of them. A reminder, this cafe series is virtual. We have quite a large number of people joining us today, so if at any time your bandwidth is experiencing any issues, I suggest you turn your video off. That tends to improve the bandwidth, and please keep your mute on while the speakers are speaking. We've allowed question and answer, 15 minutes at the end, if not more, and we're very open to questions. But without further ado, let me hand over to Petra Nahamas, who will take us through today's cafe. Thank you very much, Petra.
Thanks, Gemma. I think we should go straight into our first presentation, which is an overview of the 2020 census round in Asia and the Pacific. And that's going to be presented by Mr. Christophe Lefranc, who's the Regional Population and Development Technical Advisor at UNFPA. So we're going to be controlling the presentation from here for Christophe. Thanks, David. Christophe, tell us when you want to go to the next slide. There might be a slight delay, so we'll tell you when David will tell you when he's gone to the next slide. Over to you, Christophe.
Thanks very much, Petra. And thank you for having me giving this of the census round in Asia Pacific. Of course, we are in the, I think we can go to the next slide. Of course, we're in the middle of the COVID-19 pandemic, and that has been disrupting population censuses the world over on a number of different census stages. Of course, we there are other census work that are affected also by the current situation. Of course, in the field work, it's not only about the enumeration, but it's also about the cartography, the undertaking of the pilot census, some training activities that are impeded by the current situation. So there's a whole range of different census stages that are being disrupted. There's also some disruptions that have been quite problematic in terms of the procurement of census equipment for some countries, with the supply chain being disrupted. Can you hear me? I hear another voice on the... And then finally, there's also this important problem related to the fact that some resources that were being targeted for the census are being relocated to other aspects that other more urgent needs in response to the COVID-19 situation. So if participants are interested in seeing what's been happening in different countries, UNFPA and also the UN Statistics Division have put on some web pages in which overview of what's going on in the different countries. The first one, UNFPA Census Status Dashboard, which is an interactive application providing an overview of latest disruptions and postponements to the censuses of the 2020 round. And the second one, the second link is from the UN Statistics Division, and that covers the censuses that were planned for this year, for 2020. And that's an update from census offices on what their situation is and how they cope with the current situation. I think we can go to the next slide, please. Just before I go more specifically into the situation in Asia-Pacific, I just want to highlight a couple of census resources that have been put up by UNFPA as a result of the COVID-19 situation. The first one is provides general recommendations on the continuation of census processes. There is some discussion on the need for continued census advocacy, and also some discussion about the need for continued capacity strengthening and the development of virtual tools for that. The second link and resource that's here, it's on the value of model population estimates for at different stages of population censuses. Of course, model population estimates cannot replace the wealth of information that are provided by censuses, but they can help, for instance, in planning for a more efficient fieldwork by using recent geospatial information, satellite imagery to predict population density, derive some population estimates, and help with the census planning process. So this is not a miracle solution that will replace your census that cannot take place, but that's something that can possibly be of help. Now, if we go to the next slide and turn to the situation in Asia-Pacific. Next slide, please. So the 2020 round of population censuses cover a 10-year period that extends from 2015 to 2024. I think we could move to the next slide if it's possible. Yeah, thank you. No, I think we need the previous one because I wanted to highlight that a number of countries have already undertaken a population census as part of the 2020 round in the last few years. So the list may not be absolutely complete, but there are a number of countries which, starting from 2015, which have undertaken a census that can be labeled as.
Sorry, Jonathan, you could kindly begin to wrap up.
Sorry?
If you could kindly begin to wrap up. I'm sorry, the time is limited.
Yes.
Yeah. Thank you.
Yeah. So I was saying that a number of countries already undertook a census of the 2020 round, and some of them were planning to have a second one as part of the census 2020 round. But in a way, these countries are the lucky countries which census went just before the pandemic hit. And we have, for instance, Mongolia, which had their data enumeration conducted in January. Now, of course, there are some disruptions in terms of data processing, but still the most critical part of the census, which requires fieldwork, is behind these countries. Next slide. At the other end of the spectrum, we have a number of countries that were planning to have their census of the 2020 round later on towards the end of the period. So these are a bit more safe. There's still time. But the majority of the countries, I counted as many as 18 ESCAP member states that had planned their census for this year, 12 next year. That's where plans are being disrupted by the pandemic. Next slide. And what to do in the current situations? Well, some countries, especially those that were planning to conduct the enumerations towards the end of the year, are still planning to conduct it as planned, like China. In some Pacific Island countries, there hasn't been a single case of COVID-19, so some countries are keeping on their schedule as planned with the monitoring of the current situations. Other countries that were in the middle of almost ready to conduct the enumeration, and we'll hear from 3 of them later on, have delayed, postponed by a few weeks. And I must say that some of the countries which were planning to apply multimodal data collection are in somewhat better position to readjust and change a little bit the census process. Other countries have all.
I'm sorry, but we're going to have to. Okay, we really need to end. I'm afraid.
Other countries have completely decided to postpone by a full year, and then we have the countries that are conducted the census in 2021, which are not going to be much talked about today, but which are in the middle of their census preparations and are badly affected by the COVID situation. Then on the last slide, I had a couple of common challenges that countries are facing. The idea that we recommend as UNFPA is not to completely change the census methodology at the last minute, because that will have a detrimental impact on census quality. In most cases, countries need to revise their timeline, develop some contingency plans, and of course continue to advocate for censuses which are the data from the census are even more critical now in the COVID-19 situation than before. So despite funding concerns, censuses are still needed and will need to take place. So let me stop here and we can hear from the countries. Thanks.
Thank you. Thank you very much, Christophe, and apologies for having to be so strict on timing, but we only have 1 hour and lots of panelists. So thank you very much for that overview and those points. And we will make the slides available so people can look at them in their leisure. And of course, I'm sure they'll contact you if there's any follow-up. Now I'll move to Singapore, who will discuss their experience with the census. And our presenter is Miss Chia Sing Miss Chia Sing, who is Director of the Census Office at the Department of Statistics. Ms. Seat, over to you.
Thank you. First, thanks to ESCAP for organizing the Stats Café series, and a very good day to all who are joining us today. I'm Chia Sing, and I'll be sharing on Singapore's experience in conducting our Census of Population 2020.
We can't yet see your slides. Are you sharing your slides? Yeah. Okay. Now I can see it's coming up. Thank you.
Context: Singapore is a small city-state. We have a population of 5.7 as of 2019. We have adopted a register-based approach since 2000. This meant that administrative data from different sources are used to provide basic demographic information for the whole population. In-depth information that are not already available from admin data are then captured through a large-scale sample survey. So the actual Census 2020 survey is only conducted for some 150,000 households. This survey data collection was launched on 4th February, while the census reference date is 30th June 2020. This ties in with the reference date for the mid-year population estimates from our registers. For the census data collection, we applied a multi-mode strategy to cater to varied profile and needs of the population while balancing resource considerations. So a tri-model approach was planned for the 2020 census, and this comprises of online self-enumeration, where respondents can submit their census through the internet on their own, computer-assisted telephone interview, where they call the census hotline to have their survey completed over the phone, and face-to-face interview where...
Miss Seat, I'm sorry to interrupt you. I was wondering, we're having trouble hearing. We're getting comments as well from other participants that are having trouble hearing. Would you be able to please speak closer to the microphone and maybe speak a little bit slower, because people are having trouble hearing?
Okay, is this better?
Yes, that's a bit better. Thank you.
The model approach, we have online self-enumeration where the respondents submit their survey through the internet. We have the computer-assisted telephone interview where they call the census hotline to have their survey completed over the phone, and face-to-face interview with interviewers visiting their homes. Since the online submission was introduced back in 2000, we have observed a steady increase in the take-up with growing internet penetration and growing acceptance in performing transaction online. However, while we project about half of the population to be completing their census online in 2020, there is consistently a pool of about 15 to 20% who are still not able or unwilling to switch over to do the survey online or through phone. For the census office, the online submission reduces the manpower resources that would be required to reach out to households. For respondents, it is convenient. It is a convenient platform for them to submit their returns directly without having to go through a third party. Also, because it's available round the clock, there is flexibility to response as and when they like. Over time, we have put in more self-help features to minimize touch point and human intervention, and to make online submission more seamless and contactless. For example, respondents can actually reset their passwords, request for reminders, or prevent other household members from accessing their forms. All this are done online without having to go through any census offices. For the 2020 census, we also implemented a virtual assistant on the submission portal to allow users to self-help on frequently asked questions to reduce the enquiry calls into the hotline. Much of this has reduced the resource demands and keep the responses coming in amid the COVID situation, as we'll see later. So other than online, alternative channels are provided for respondents who are less tech-savvy, who may not be literate, or simply are not so motivated to respond. These are deemed necessary to elicit good response. The call center reached out to those who did not complete their returns online by a stipulated deadline. And this is also important in supporting the online submission and respondents' feedback. For face-to-face interviews, these are still needed to reach out to those who do not respond online or do not have phone numbers, as well as those who are not so willing to participate in the census. This is also where we ascertain invalid addresses. However, the extent of face-to-face interviews and visits as a whole has been kept to be very limited so far for this census. To understand the impact of the COVID-19 on our census, let's first take a look at how the situation has evolved in Singapore. Here, the first confirmed COVID case was reported on 23rd January 2020. At the beginning, cases were mostly imported with no evidence of community spread, so the measures taken were on temperature taking and travel restrictions for travelers with travel history to high-risk regions. But by mid-March, with a few locally transmitted clusters identified, more safe distancing measures were announced, including some at the workplace. While Singapore did not go into a full lockdown, we implemented a nationwide circuit breaker from 7 April to 2nd June. During this period, all persons were to stay home, while except for those who are working in essential services and when they need to go get essential goods and services. So even after during the immediate period after 2nd June, only selected workplaces resumed activities. Further reopening only happened after 19 June with more workplaces reopening. So to date, we have slightly over 43,000 confirmed COVID cases in Singapore, though a large majority was among workers who are staying in dormitories. The situation and measures have implications on our census operations. As mentioned earlier, the census collection was launched on 4th Feb. This meant that we started less than 2 weeks after the first case of the first COVID case was reported, and shortly before Singapore raised our disaster outbreak response system condition from yellow to orange, which this led to a period whereby there was public uncertainty and even a few occasions of panic buying at supermarkets. And for the bulk of our operations, since we have to maneuver and adjust to the various updates to the government response to the virus, we suspended the census face-to-face visits from 15 February, so that's 11 days after our launch. And we had to arrange for visits by appointment only and on request basis. This was in view of potential public resistance and public health risks when community cases and local transmission clusters start to surface. And as an added precautionary measure to protect our offices, respondents were asked to make a health and travel declaration prior to our visits from around early March. So with few follow-up slowing, progress for each of the batch has stagnant after about 1 month, and a third reminder on top of the originally planned advance notice letter and 2 other reminders was then added to boost response. Separately, aligning to the nationwide measures and recommendation for workplaces, the Census Office ran on a split team arrangement from 29 March, and we had to convert to a full work from home arrangement from 7 April when our circuit breaker started. So while internet submission and hotline continue to be operational, call operations were scaled down significantly with a small pool of officers working from home. Instead of having a fully functional call center with automated outbound dialing system to handle the call volume and phone appointments, the team had to adapt to using call routing to receive calls and to make manual calls out. Fieldwork was also hot during this period. So relying mainly on mail notifications and phone follow-up, we managed to complete the census survey for about 70% of the sample so far. The last 20 to 30% will be the harder to reach group. Since then, full call and data processing operations have since resumed in split team arrangement from 21st of June after the phase 2 reopened. But there remains some catching up to be done to bring the operations up to pace. Field visits have not been reinstated yet, but we are planning to do so somewhere in mid of July. So all these are also reflect is like mechanisms and might help us mitigate the impact of the COVID. And total of the census 2020, which we have used and improvised over the years, is the splitting of the sample into batches for rolling out. The main purpose that this was trying to achieve earlier was to manage the caseload on the internet server, the call traffic to the hotline, as well as to minimize exposure risks for individual households when their records are put on the internet. But the design of this staggering of cases into batches provided some flexibility for our office to adjust the release dates and sizes for each batch this round. So it becomes a tool for us to make operational adjustments in response to the evolving situations and the different measures that will roll out over time. So for example, when we were to scale back the operations, a smaller batch was released to cushion the effect of having a reduced manpower. Coupling with this, we also leverage analytics to monitor the progress of individual batch and follow up with adjustment, in particular on the intensity of reminder letters sent to household. In the chart to the right, we can see by batches, we see a step down.
I'm sorry to interrupt, but would you mind kindly wrapping up now, please? Thank you.
Okay, thank you. So for the chart, we see the step down in responses for selected batches, and this was due to suspension of reminder letters during the circuit breaker period. So, okay, the last slide. As a start, for the operating context for the census, we actually plan to launch the census 2020 1 month ahead of the schedule that we had in 2010. So this provided some buffer for us. This was learning from the previous census where we had to make contingency plan for H1N1, though at that time it wasn't activated. Then for us, because we are operating it on a register-based census approach, so the data on population estimates are compiled from admin records, and top-line data will continue to be produced on schedule. So this, like I've mentioned earlier, even with all this that were put in place, there are still some catching up that is required over selected population group, which requires face-to-face assistance later on. Yeah, so that's all for my sharing. Thank you.
Thank you very much for that very interesting presentation. We're going to move very quickly on to the Philippines, which is obviously facing a very different set of challenges. And this presentation is going to be by Ms. Minerva Eloisa Esquivas. I hope I pronounced that correct.
Yes, thank you.
And
yes,
who
thank
is
you.
the Assistant National Statistician of the Philippine Statistics Authority. Over to you.
Okay, thank you very much, Petra. Thank you for inviting the Philippines to share its experiences with regard to preparation for the census amid the COVID-19 pandemic. So go to the next slide, third slide, please. The PSA is supposed to conduct its 2020 census of population and housing last May 2020. The census is actually a mix of PAPI for the majority of the provinces in the country and COPI for 2 provinces due to resource constraints. But for certain respondents, we're actually targeting to use the CAWI. I think the slides are not moving. Petra, can you go to
we're just checking.
Fourth
slide. There's the fourth slide. Okay, sometimes there's just a little delay. David, can you confirm fourth slide? David, fourth slide, please. Okay. Is this the correct slide?
Okay, yes. Okay, on the as I mentioned earlier, so we'll be implementing the PAPI, CAPI, and the CAWI. On the basis of the census law, actually the public school teachers should serve as enumerators in the census. So in that case, the PSA and the Department of Education already forged an agreement to implement the census law. Next slide. Since last year, next slide please. Since last year, the PSA started the procurement of supplies for that are necessary for the census. We also started with the recruitment and hiring for census-based office-based census workers that began in February. The task force training was actually conducted in March prior to the lockdown. The participants of the task force training came from all provinces and regions in the country. Thus, fortunately, before transportation was suspended, they were able to go back to their respective provinces. Next slide. In fact, the implementation of the state of public health emergency in the country was the declaration of the entire Luzon under the enhanced community quarantine starting 17 March. This took a heavy toll actually on the census activities as all businesses were closed, transport facilities were suspended, office work at PSA was mostly done virtually. In other words, all activities for the census were hampered. Several issuances followed thereafter until all parts of the country, including the National Capital Region, transitioned to a general community quarantine, except for a few high-risk areas in the Visayas, which remained under ECQ. Next slide, please. Consequently, in March 2020, PSA already issued an advisory regarding the postponement of the census due to the COVID-19 outbreak. Next slide. With the COVID-19 pandemic, field operations was heavily affected. This resulted to the postponement of the census data collection. Next slide. Printing services for questionnaires and manuals stopped since the production unit was closed and workers ceased to report. Next slide. Similarly, the supply and delivery of various supplies, materials, and other paraphernalia of enumerators and supervisors were affected. They cannot deliver the goods expected of them per agreed upon timeline as a result of the effect of the pandemic on the supply chain, starting from the importation to the delivery, transport, and shipment to all our field offices. Next slide. Given the no census in May, the public school teachers' participation may no longer be feasible. The Department of Education already informed us that their participation cannot go beyond June 15 as they need to prepare for the opening of classes under the new normal. Doing a census after June 15 will therefore result to PSA hiring all the manpower requirements. As such, the availability of classrooms, which we usually use as training centers at the city or municipality level, is at stake also. Next slide. The succeeding batches and levels of training were postponed, and of course, the data collections needs to be rescheduled. Even so, the fear of COVID-19 will definitely affect the conduct of the face-to-face data collection. Next slide. What did PSA do with the pandemic in our midst? So we coordinated as early as possible with the various offices, committees, and census boards at the national, regional, and provincial and city municipal levels to consult them on the prevailing conditions at the local level and seek their opinion as to the postponement of the census to a later date. Next slide. Of course, we did also consult the interagency task force, which is in charge of the state of the country at this time, as well as the Office of the President and Congress as to the feasibility, legalities, and other statutory requirements, and as well as the health impact of doing the census at a later date. Next slide. At the moment, PSA has been granted an exemption by the IATF or the Interagency Task Force as to the restrictions being imposed in the quarantine scenarios. Specifically, it allows PSA to do its data collection activities with the minimum health standard protocols. Next slide. So with that, PSA was assessed various timelines in consideration of the local conditions in the regions and in the provinces and in consideration of other activities of the PSA, such as the surveys and the registration of the citizens for the national ID. So at this point, we are actually scheduling the census in September 2020 unless there are some triggers that would warrant us not to do so. Next slide. So given this, we have to realign the budget and the resources for the emergency of the standard health protocols as required by the IATF, which includes alcohol, masks, training, rental of training centers and processing areas, and the hiring of census workers instead of the teachers who cannot anymore participate in the census. Next slide. We also resumed the recruitment as of date, given the exemption. We also did online recruitment process and coordination with local government units, and our legislative district representatives actually said that they will assist us in the recruitment part for the census. Next slide. We also made modifications. Next slide. Made modifications in our advocacy, emphasizing on the very short time for interview, its confidentiality and safety of our respondents as well as our enumerators. Next slide. Next slide. We also revisited our training with respect to doing social distancing if they opt to do a face-to-face training. Otherwise, we provided them alternative methods of training materials, such as having a Google Classroom where they can do an online training, as well as production of the audiovisual presentations for use in their training. And again, during the training, we have to impose minimum health standard protocols, so that we have already issued to our field offices our memorandum circular with regard to this. And also, we have a briefing during the training on the protocols for proper hygiene during the training and data collection, as well as steps or measures that we'll need to take in case of observation of symptoms of the COVID-19. Next slide. We also opt to use alternative mode of census data collection that we planned beforehand, which means minimizing our face-to-face contact with the respondent. We have the computer-assisted web-based interview, or the CAWI, which we said earlier that we are only opening this for targeted respondents. But now we are actually doing listing operations that will require respondents to give their options, whether they want to do a face-to-face interview, a CAWI, or a paper-assisted telephone interviewing, so that we can contact them and interview them by phone, or they can be given access rights to access the web-based interview. Next slide. Now we are enhanced community quarantine. So these are high-risk areas, and the census may not be advisable unless they do the online data collection. Next slide. For my concluding statements, while the COVID-19 pandemic may substantially affect the usual statistical business processes, this will not stop the PSA to deliver good quality statistics, as the government has been counting on the PSA to provide information to them, especially so that the PSA is actually given an exemption by the IATF, and also anticipating the new normal amidst global pandemic. Alternative census data collection methods that I presented earlier will have to be improved and developed. And then public awareness campaign about the assurance of the safe conduct of interview during the difficult time may convince people to participate and support the census taking. And as a last note, as I mentioned earlier, I think given that we have set it in September, unless there will be some triggers and I think some impositions that will have to be given by the proper authorities such as the Congress and the IATF, then we have to cancel the census and work on other alternatives such as what Christoph mentioned a while ago, population estimates. If we cannot do it next year, because the Philippines right now will be having several activities slated for 2021. Thank you, that's all, and stay safe, everyone. Thank you.
Thank you for such an excellent and rich presentation. And again, to say we make these slides available, as I'm sure that there'll be a lot of interest in the material which is in them. So I will hand over now to our last panelist, and that's Mr. Nasrul Wajdi, a statistician and researcher from the Indonesian Bureau of Statistics. And you'll be doing your own presentation. Yes, you already got it out. Thank you. Over to you.
Thank you very much. Good afternoon, everyone. Thank you, UNESCAP, for organizing this event. It is with great pleasure for me to share Indonesian experiences on how we conduct our census in this pandemic era. So let me start with our initial plan. If you can see here in this first slide, at the beginning of 2018, we started the planning of census, recording 269 millions of people living in Indonesia. We plan to use population register data managed by Ministry of Home Affairs as the basis of our population census, combining registration data with the traditional canvassing. Our target was to record all population living in Indonesia, despite of their race, nationalities, sex, or religion. All population living in Indonesia have to be recorded. We plan thoroughly. We prepare risk mitigation in almost all aspects. We assess all possible risks, even the worst risk. But we did not prepare for the pandemic. So first lesson, the worst scenario could be more worse. Okay. So here we are now on March 2020, WHO stated that coronavirus disease or COVID-19 as pandemic. We are in the middle of conducting our online census when physical and social distancing was implemented. Indonesia responding on this pandemic by extending the special emergency case for the pandemic issued by the National Disaster Management Agency. At this stage, we decided to extend the online census period until the end of the special emergency case of disaster, May 29th. One of our strategy for increasing the response rate was by approaching schools, universities, and public crowd. We even had a program called Ngibar. Ngibar in Indonesia means ngisi bareng, filling the online census form together. We found this strategy was effective on increasing people's participation on online census, aside from massive campaign through mainstream media, such as social media, even ads on public transportation. But due to the social distancing protocol, we are no longer able to use offline campaign. We rely on online campaign. As the result, up to May 29th, there are about 51.36 million of people participating on online census. But as you can see on the graph, the extended period graph is flat. You can see from the 1st of April up to 29th of May, except for the last day of the census, the graph is flat. It could be also because the online census trend hit and drowned by COVID-19 issues. Second lesson learned, mainstream media campaigns should be revisited. The campaign strategy should be aimed for engaging people, involving them in the process. Not long after the online census period came another issue. I think we face the same issue. There is a competing funding in our government spending for COVID-19 versus routine spending. All government office budget was cut. BPS budget was cut up to 43%, which affect the funding for census because the largest portion of our funding was for census. So the census budget was cut up to 74%. It was 219 million US dollar. Now we only have $74 million. It was 1.11 US dollar per capita, but now it became only 28 cents per capita. The largest portion of this initial budget was to hire census takers, around 400,000 census takers, which will be paid around 259 US dollar on average. So with the money we have left, we have to recalculate everything. We have to have a new plan. We are not able to use our initial plan since we don't have enough gasoline to run the machine. We have to change our machine, which means change our plan. This is the first constraint, budget. We only have this amount of budget, no more. So the first adjustment is to identify what will the output we can produce that have the largest impact on our future business. The nature of census, as you may all know, is to calculate stock. The stock of population, mainly by sex, age, and geographical area. These data are essential for sampling frame as well as the basis for population projection. So we started to think how to get these outputs. In our initial plan, we have 3 phases for field data collection. The first phase here is desk job verification of population register. We have population register generated from administrative data. Our census takers, together with the head of neighborhood area, will check the population register list to ensure that the list already contains everyone living in the area. Not only those with ID, but everyone living in the area should be registered on the list. Second stage is field verifications. Once the desk job is done, our census takers, together with the head of the neighborhood area, will do the canvassing, door-to-door verification. Verify each person living in the area to ensure that everyone is registered. Third stage is individual enumeration, face-to-face interview for those who are not participate on online census. We found that our strength is mainly on the first 2 stages, the verification of the list and the field verification. So therefore, due to the budget constraint, we decided to strengthen the first 2 steps. What about individual enumeration? Initially, we planned to do face-to-face interview using CAPI or PEPI. But again, due to budget limitation, we are unable to do so. So we decided to change stage 3 from face-to-face interview into drop-off pick-up or DOPU mode. At step 2, when our census takers do the field verification, instead of interviewing respondent with the questionnaire, our census taker will drop the questionnaire that will be filled by respondents. We also give them an option to fill the questionnaire online, an online form, O-form or online form. Our census takers then will come back a few days later to pick up or collect the questionnaire from the respondents. A lot of adjustment that we make due to this budget constraint. Unlike Philippines, Indonesia, we don't have no classical training. We don't have classical training to all our census officers. Instead, we use e-learning and independent learning. Here comes the next challenge. How to design a simple form that not only easy to fill, but also easy to understand. Not only by our enumerators, but also by our respondents. So we simplified the form of our population register list by reducing the use of codes. There's no codes used, or there's a very minimal code used in the population register. We use a simple form. We also simplified our short form questionnaire from the scanned version, the C1 questionnaire, into this one, the alternative one, the data entry one. The price we have to pay is that we rely the data quality on our respondents. thanks to ABS, the Australian Bureau of Statistics, who assisted us on developing this DOPU questionnaire. From this scan version, this C1 version, it's a scan version, to this simplified version, C1A version. We have to take out some variables, the initial variables from C1, but since we don't have enough space, again, due to this budget constraint. So to summarize, here is our new plan. Instead of having the face-to-face enumeration that initially planned on July 2020, we are going to use DOPU, drop up and pick up, on September 2020. We extended our online census that was initially planned on 31st of March. We extended it into 29th of May. And then we plan to still using the online form, the computer-aided web interviewing, but we rely our data quality on respondent because we are only using DOPU, the drop-up pick-up mode, for updating individual characteristic. What worries us much is the response rate and data quality. So to increase the response rate, aside from simplify the questionnaire, we also work together with other government agencies to encourage people participate in the census. At this time, we rely on administrative data and people participation. The last lesson learned from the pandemic is we still have to have a good quality data that will help our decision makers on taking action fast and accurate. My name is Achul. Thank you very much for your attention. Good afternoon.
Thank you very much, Achul, for such a great presentation. And I mean, I think we're all kind of looking at the challenges faced by Indonesia by such a drastic slashing of your budget, and appreciate the way that you're trying to address these issues. We'll move over very quickly to the Q&A. I mean, we want to give it the full 15 minutes, so I hope everyone will be okay if we go a little bit over the time. I'm going to start with questions which have been, a couple of questions which have been submitted ahead of time. And then we'll go to the questions submitted by the participants in real time. We will be monitoring both the chat in the Microsoft Teams and the YouTube connection. So please, can you write your questions in the chat and we'll try to get to them. And if we don't manage to do this in the 15 minutes, we will try to address your questions after the presentation has finished. So, if we don't get to your questions, don't worry, they're not going to be ignored. We will try to address them in writing. So the first question, which is actually, I'm collating a few different questions which came in ahead of time. And there was a lot of concern around the dropping of direct interviewing or face-to-face surveying as a response to the COVID-19 pandemic. And people were concerned about the low response rates or errors from the different alternative technologies which are being used. How are you ensuring that the quality of the responses is going to be the same as the face-to-face or as close as possible? And I guess this would go to any of the panelists who would like to answer. So I'll maybe start from the last panelist. Achul, would you like to respond to that question?
Yes, but I have trouble which question because I see a lot of questions here. But
the question is, this was actually from questions submitted ahead of time, and there's a concern that have been raised from participants around the dropping of face-to-face interviews or surveys, and the use of alternative technologies and the effect that might have on the quality of the responses.
Yeah. So as I said, in the closing of. In my closing statement, what worries us much is the data quality. So what we can do is only how to strengthen the canvassing stage in our phase. The canvassing stage, which I have explained, is when our census takers, together with the head of the neighborhood area, will check the list. That's the canvassing stage, to make sure that everyone is counted, to make sure that everyone is registered on the list. And the quality of the data, for individual data, we have the data from the Ministry of Home Affairs. We have the administrative data. Of course, there are some challenges of using the data, but at least we have the data, and then we will use the data as well, using some kind of statistical techniques as to impute those non-response during the field. Yeah, we are going to have a lot of questions about the data quality, but what we can do is to strengthen, to make the canvassing, just to ensure that everyone is counted. And if you ask me about, we are going to change our plan, do we do some testing on doing this? Yes, we are now currently doing the testing for our new new plan for our census. Currently, we are conducting e-learning for 10 provinces that will be doing this testing for the next 7 days. So yes, we need to test all of our new plan. We need to test all of our forms so that we can aware what kind of data quality that we will have using this this new plan. Yeah.
And would Singapore, would you like to comment on that, especially since you have you're using the internet for responses? Is there anything you'd like to add to that about the data quality?
So actually for internet responses, we do notice that self-enumerated data, that the quality tends to be poorer compared to when we captured it through interviewer assisted type of mode. So what we do on our end is to put in more intense consistency checks, and for us, similar to Indonesia, we do have some form of administrative data that we use to put in consistency cross-checks, so that there are certain questions that may be more tend to misreporting, and we focus some checks on those.
Okay, thank you very much. Can I kindly ask the panelists to also turn on your cameras? Might help also with to be able to see you as well if you have the bandwidth. And then I'm going to just go to another question which was collated from a number of questions which were submitted ahead of time, and this one I'd like to address to the Philippines, and this is questions around the implications of delay on population projections or any other aspects that might be impacted by a delay in census, since you mentioned that postponement during your presentation. Would you like to perhaps address some of the implications of a delay?
Yeah, of course, when you delay the census, definitely the computations for the population projections will be delayed as well. But right now, the Interagency Committee on Population and Housing Statistics is in close coordination with the PSA as to the methods and the techniques that we will be using, even if the results are not yet available for use in the projection. But right now, we're already trying to work on the methodology for projecting statistics. Population.
Okay, thank you. And the next question, which I'm taking from the chat, is from Hem Regmi, and the question is for Christophe of UNFPA. And the question is, what are the recommendations from UNFPA side on conducting these censuses at this time? Is it to postpone them or go ahead with the new normal? What would your recommendations be?
Thanks, Petra, and thanks for the multi-million-dollar question. I think there's no standard reply that would be good for every country and every context. I think that the census is still needed, as I mentioned earlier. So if there's a possibility to have it, postponing may not help, because mobilizing the resources needed for the census may not be much easier in the future. That's one thing to consider. But I think what we are concerned about in terms of implementing censuses is the quality of the data that we derive from them. So it's all about having in place proper quality assurance processes, and that deals a lot with testing, as was said by previous speakers. So, I mean, if the census timeline can be reasonable and can fit all the different necessary tests and preparatory activities, then I don't think that there's a need to postpone the census just in principle. So I think every country, every situation is different and needs to figure out what's the best in their context. What we strongly do not recommend is to completely change the census procedures at the last minute without proper quality assurance, which means basically without proper testing. So I don't think I have a much better answer to provide than that.
Yeah, thank you, Christophe. And I think we all understand the difficulties and the intricacies in addressing these issues. I will take another question from the chat, and this is actually to Indonesia, but to Achal. But I guess if anyone else wants to jump in, that would be fine. But Achal, the question here was about your new revised short set of questions. Is that going to be sufficient for decision makers and other users? Is it going to provide sufficient data? Or is there going to be, I guess, gaps in data for policy as a result?
Yes, we have a lot of kind of arguments that this data now, the variables that we have in our short form is more than enough to continue our next business process. Let's say for planning our surveys and etc. Because these short forms is only contain very less, only 21 variables. But next year we are going to have a long form that will have a lot of questions that will be able to provide the data needed by our government. Yes, so the idea for the census is now to have a strong sampling frame. So that's why we need to make our short form variables very short. We only put an essential variables like name, like not name, date of birth, sex, educations, or even some of the questions on household facilities that will be able to help us to continue our business, say household survey. If there's always a trade-off between numbers of variables and the data quality. So since we decided to record 269 million of people in Indonesia, so we decide for this complete count, we are going to use very short variables, and we decided to have a long list of variables next year using around 5% of the total population of Indonesia to have a more detailed information. But our goals now is to have a strong sampling frame for our future surveys. I hope that answers your questions.
Thank you. And I'm going to take now a question which has come in from the YouTube channel, and this is to Singapore. And the question is, how is the misreporting of online or poor quality of online information being addressed? Are there any methods that you're using to address or correct for misreporting? So I know you addressed that briefly previously, but I think the question here is around if you're using any methods to adjust or correct for misreporting. And that's to Singapore.
So for our case, we do capture information on their contact information. So the first step, of course, if they are able to provide this contact info, we do reach out back to the respondents to clarify the information that were reported. So that's the first line of data processing that we do. So beyond the clarification, we also go back to look at our administrative data to check for the consistency. I think I mentioned this earlier on. So in terms of the reporting, how whether there is certain consistency that we can pick up from the data that was reported versus the administrative data. So this could include things like work information that were reported to administrative sources, and then we will do some comparison from there.
Thank you. And I think the last question to close, and I think we could address this to the Philippines. This is from the YouTube channel. And the question is, if the pandemic continues, and I guess and if it gets worse, how will that impact your administration of the census? And do you have any alternatives?
Okay, as I mentioned earlier, unless there is a trigger, we will be canceling the census in September, because we cannot do any more a census beyond September, because we have the registration for the national ID system that is also a very, very big project in the Philippines. So we will come up with an alternative such as population estimation, or unless the government will have to tell us that the census can be done next year.
Okay, thank you very much. Are there any last words from any of the panelists before we close? In response to any of our questions or anything you'd like to add?
Thank you, Petra, for inviting the Philippines. I saw a message in the meeting chat that there's a question on the confidentiality of information if we hire interviewers. I just want to respond to that,
Sure.
the hired personnel has a contract that states their responsibilities, including treating the data as confidential, and as well as penalties in case they violate the confidentiality provision of the census law. So there's some kind of taking on the part of the interviewers, and they are actually supervised by a lot of supervisors, including PSA personnel. Thank you.
Thank you, and I'd like to thank really all the questions that have come from the participants and all the excellent panelists. And we will address those questions. We'll make them available to the panelists who can answer them all in writing. So we will get to all the excellent questions which have been submitted. And thank you to the panelists. And I'll hand over to Gemma to close.
Yeah, thank you very much, Petra, and thank you very much to all of our presenters today. Very interesting lessons to learn for across the region, and really very grateful to Singapore, Indonesia, and the Philippines for sharing your experiences with us. Ladies and gentlemen, this ends our Stats Cafe today on population census. It's been a real pleasure to have. We had about 150, maybe even topped it at 200 people joining us today. And we'll be continuing to bring you this Stats Cafe series throughout this period, as well as hopefully beyond. We're proving to be very great to bring you just-in-time information on what's happening in our region. So thank you again for joining us. Thank you to all of our presenters, and to Christoph from UNFPA, and to Petra for moderating this, and have a lovely day. Thank you very much.
Thank you.
Thank you very much.